Hi everyone, I am Dr. Krishna Reddy, consultant endocrinologist, Medicore Hospitals, Madhapur. Today we'll discuss regarding diabetic neuropathy. So one of the most common complaints from the patients in the regular day-to-day OPDs. So we generally see almost 60 to 70% of the diabetic patients, they will be having some amount of neuropathic symptoms. This diabetic neuropathy is actually multifactorial. Apart from the glycemia, so other vitamin deficiency, sometimes alcohol and other factors also will play a role in development of the neuropathic symptoms. Especially if you are a diabetic, sometimes pre-diabetics, that is before onset of diabetes also, some of the patients will complain of the neuropathic symptoms. And sometimes if the sugar control is not good, so some people will experience this neuropathic symptoms, they will immediately come to the medical attention. This neuropathy majorly has been divided into the large fiber neuropathy, small fiber neuropathy, and autonomic neuropathy. The various signs and symptoms are loss of balance and posture, as well as loss of pressure sensation. And small fiber neuropathy, so they will be having symptoms like pins and needle sensations and paresthesias, numbness. And these are the symptoms of small and as well as large fiber neuropathies. So whenever there is a loss of pain sensation, that is loss of protective sensation, so these are the patients who are going to prone for the high risk of diabetic foot ulcers. They will easily go for the trauma. So because of loss of pain sensation, they won't be feeling any pain. So they'll be having a minor or major traumas, so which will eventually lead to the ulcer formations because of the loss of pressure sensation. So these ulcers will be very chronic and they doesn't heal properly without half loading, without having a proper glycemic control. Apart from these neuropathic symptoms, they will be also having autonomic neuropathy symptoms like especially postprandial fullness and some bladder dysfunctions, bowel dysfunctions, and as well as this erectile dysfunctions, sexual problems. So these are also common neuropathy symptoms in diabetic patients. So whenever there is a neuropathic symptoms, they should have a proper control of blood sugars, and they should have their checking of their vitamins. They should properly take this multivitamin supplementations and essential fatty acid supplementations. And if you are taking alcohol, you should avoid the alcohol so that your neuropathy can subside. In worldwide studies, the neuropathy prevalence is almost 10 to 20% in all the diabetic patients. So these neuropathy symptoms you should not neglect. So whenever there is a higher paresthesia sensations, they will lose the sensations capabilities, and they will land up in the loss of protective sensation. So almost any peripheral vascular, if you take the foot ulcerations, 70% of them are diabetics who has a neuropathy. So this loss of protective sensation will lead to the various complications, and especially the foot will prone to injuries. So these people, they should have a proper protection of their feet. They should regularly check their feet and regularly wash their feet, especially in the interdigital area. And after washing, they should immediately dry it. Otherwise, that skin will prone to the fungal infection and other forms of infections. And the protective footwear is very, very important, either in the form of shoes or in the form of a closed slippers. So they should have cover all the areas of foot. The foot should not come out of the footwear. And with a proper management of footwear and half loading and proper glycemic control, then only any foot ulcers or any corn formation that will be get healed.